pausing for me. Here we go. Here we are. Beautiful spring day. Guess what I saw this morning? Grass. I saw grass peeking out on the side of the snow. Now, I know I'm realistic. I realize we're going to get a big snowfall. We're going to have several more dumps, but grass is there. And I'm feeling very hopeful when it starts getting warmer and the sun comes out and I see grass. I know flowers are coming anyways. I'm feeling particularly happy and hopeful today. Um, Today, we're going to talk about how to navigate challenges in the healthcare system. In my practice as a clinical social worker, right now I work in Montreal and I work directly with clients in Montreal, but I also do online consulting for people all over North America. And the concerns are usually pretty consistent. I can't get a hold of anybody. My doctor won't call me back. I don't understand my illness and the treatment and why we're doing what we're doing. One doctor tells me I should take one medication. The other doctor tells me I shouldn't take that one. It's contraindicated. They're, interfering with one another. How do I get my specialists to talk to one another? I'm not being heard. The treatment team is suggesting interventions that I'm not really wanting or I don't understand what they are. The healthcare system can be very complex, very hard to navigate, confusing. And for people who have more than one health problem, it becomes even more complicated because you have different physicians and different specialists. And it's hard to kind of like organize it all and keep track and understand what you're doing and navigate that system. So today we have an expert on, and we're going to talk about how to advocate and navigate the system. I'm so happy to have you on. I have Dr. Annette Ticoras. Hi, Annette.
Hi, good morning.
So let me just talk a little bit about Annette. I have to put my glasses on because I can't see. Annette is a medical doctor. She's an MD, and she's also a board certified patient advocate. And we'll talk more about what exactly that means in a minute. This is so super interesting. I also am going to ask you about this. She has her bachelor's in zoology and psychology. So
But
she's
that
laughing,
doesn't
but
come up often.
it's super interesting. I have a question about that. And you worked in private practice in internal medicine, but in 2014, you founded Guided Patient Services, Inc. And it's a way for you to help families understand their medical situation and to make the best and most well-informed choices for their own health and well-being. Thank you again, Annette, for being here.
It's a pleasure.
So, talk to me about advocacy and what that really means, because what I see throughout social media and even profiles on LinkedIn is people will say, I'm an advocate. Saying you're an advocate, being board certified are, I think, two different things. And I want to distinguish those. And also in our pre call, you talked about that an advocate can be used to designate other different positions. So let's first
hmm
just define your role as advocate. What does that
hmm
mean?
Well, I think the word advocate is a really strong word. I mean, we have legal advocates, we have child advocates. So it means someone who can step in, step beside, and look out for someone's best interests. So not someone to replace them, but someone who can step in and help and support and quote advocate for someone. So again, that is the goal with patient advocacy, is that you come alongside someone and you're able to help them, help their family, help whoever's in their support circle really get the best healthcare outcomes. But that can come in many different forms. So we have advocates that work for insurance companies, advocates who work for a hospital or healthcare system, and then I specifically am a private patient advocate, and that has a very unique definition and a very unique services, and most importantly, kind of the orientation and where you're coming from, and who your alliance and allegiance and loyalty is quite different than advocates maybe in some other roles.
Yeah, I find the same even for my position as a social worker because I'm a private
Mm-hmm.
social worker. I'm not in the system. And
Mm-hmm.
oftentimes people call me and say, hello. Someone just said hello. They just texted in, they're watching live. They said, hello, Muhammad, I think it says. I have to put my glasses. Oh, no, Muhand. Hello.
Mm-hmm.
As a private social worker, people will often call me and say, I don't want anyone in the system. I feel like the
Mhm.
system's not doing me right and I'm not being
Mhm.
heard. And I want someone with an objective opinion, but also not being paid by the institution that I'm
Right.
frustrated with. So I think
Right.
that's one of the things different. If there's a hospital advocate, it's someone that works within the hospital system. The
Mhm.
insurance advocate is being paid for by the insurance company, right?
Right. Right. So their goals and their job description is there is some overlap. Obviously, everybody's trying to find the good for the patient in each of those. But when you have a hospital advocate, they often fall under risk management. So it's, what can we do, say, appropriate in such a fashion that the patient won't be unhappy with the care that they received here and therefore wouldn't take further action and negatively that would impact the healthcare system. And when you have someone who's in insurance, an insurance company is a business, it's an entity there to make a profit. So when those recommendations or suggestions are being made of how to proceed or what to do or who to see or what diagnostic testing to have done or what treatments, the bottom line does play a role for them, and they need to uphold the goals of their employer. And that is not the case for, like you're saying, for someone who's in the private sector.
Yeah.
The client's my boss.
And there are some times when I see people refer to themselves as an advocate, but I don't see that they've necessarily had any formalized training. So
Mm-hmm.
distinguish for me, board certified patient advocate. What's the difference in terms of your training and achieving that designation versus
Mm-hmm.
someone who says, I can help you advocate in the system, but may
Mm-hmm.
not have that certification behind them?
Mm-hmm. Well, there are several national organizations that recognize people who are health advocates, health navigators, patient advocates, patient navigators. There's a lot of overlap in that terminology. But, it was basically started by folks who came from all different walks of life who found advocating as their, passion. So they could be
Mm.
social workers, they could be nurses, they could be physicians. But they also could be people who a family member had experienced cancer treatment, cancer scare, maybe a long time in a cardiac care unit. And whoever the family member was who came alongside and advocated for their family member appreciated that they learned a lot, that there was a skill set, and there was information that you gleaned in that time that they felt as though they could help someone else in similar circumstances. So, a decade ago, anyone who wanted to be an advocate can be an advocate, and that still is the case now. There is not any licensure that an advocate needs to have, but I think patients felt that it was important to start to recognize people for the experience and the education and the training and continuing education that they brought to their advocacy work to sort of set them apart, and that if we didn't start to hold ourselves accountable, maybe somebody else would choose to do so. So it took a very long time for that to be put into place so that it was done properly. So now anyone who would like to be board certified, and that is anyone, still you can come from all those different backgrounds, but there's now a credentialing exam that you sit for that then gives you the credentials of being a board certified patient advocate. And it was felt that that was really important, that designation in trying to put some not constraints, but some
Well,
goals.
to me, it's like, yeah, and it's also the ethical guidelines, right? Because as a
Mm-hmm.
licensed
Very much so.
physician, you have, professional code of conduct, ethical guidelines. I do myself as a licensed social
Mm-hmm.
worker. I have to do continuing education. And so there is that basis of things that we do as professionals and don't do. And so that's kind of the nice piece about going that extra step of the certification is that there's a framework and a professional framework constructed to
Yes,
ensure that the person that you're hiring actually, is able to balance their personal and their professional side, I
absolutely.
guess.
Yeah,
Yeah.
yeah, because there are definitely boundaries and there are lines and they're not to be blurred. And it really is essential in making certain that you are looking out for the best interest of the client in an appropriate way.
Exactly. So walk me through, Annette, a call that you receive. I know that you mentioned again in our pre-call that right now you've been super busy with COVID, and you can use
Hmm.
that as an example as if you want.
Hmm.
But I want to understand when the phone rings and you say, "Hello, this is Dr. Ticoras," or whatever it is you
Hmm.
say.
Hmm. Hmm.
What is? Walk me through a file or a case where
Right.
this is what the person says, and what do you do? How do you help them?
Um, the primary goal of that first call is to listen. So I would say half the calls I get, I will listen, but there won't be services. I'll either be able to give them a resource, give them a phone number, give them a small nugget of advice, tell them how to get in touch with a hospital advocate because that's who they really wanted. But for those, I very quickly can discern who I can help and how I can help them. But that comes by them sharing where they're at. So often they will call and say, "What can you do for me?" And I said, for me, especially with my medical background, the places that I can meet people is so diverse that it really is essential that I figure out where they're at so that I can then share with them how and where I can meet them and what value they might find in that. So a phone call with me is usually if sometimes you don't have to ask. Sometimes they're like, "I need to tell you about my situation," and so usually very quickly someone you will hear what the issues are. And I got a 2-line comment sent through my website just recently, and it could be the tagline for what I do. And it was just someone saying, "I don't know if you help with this, but my family member has multiple specialists and all their appointments are virtual and I'm not here in town, and I just feel as though perhaps we're missing something, and that her care could be improved if we got all of these voices and all of this information shared more collaboratively. Do you do that?" Well, that's kind of the essence. You extrapolate it out, but that's the essence of what I do is take all this communication and organize it and facilitate better communication amongst all the folks who are caring for someone or amongst the family members if it's a health crisis. So that I guess what I'm saying is it comes down to communication, and it's very often 95% of the time that's what the phone call's about. There may
Okay.
or may not they may or may not be getting good care. They don't know because they don't have the information they need
Yeah.
to make that
So
decision.
So you really end up in a lot of ways. I use this when I talk about the concept of team caregiving, is that the head coach is the patient, him or herself, who says, "This is exactly what I need. This is what I want. These are my goals. I may not know how to execute that plan, but this is what a touchdown is to me." That's what the head coach says.
Mhm.
And then I always like to say that then the coordinators, the offense and defense coordinators, are the family members. And then
Mhm.
we go down to the quarterback and all the players. So it's kind of like you're that quarterback, working together with all the team players, getting everyone to communicate and move effectively in one direction or another to reach that
Mhm.
stated goal of whatever it was that patient says. Would that accurately reflect you're kind of like the center point of then collecting all the dots, connecting all the dots, and
Yeah,
getting people to okay.
it does feel often like a wheel. I feel like there are lots of spokes, and especially in healthcare, they're going off in all sorts of directions, and they could go off in even more directions than most clients realize. In fact, that's another adage. I mean, most folks come to me because they realize they don't know what they don't know. And that's a very sobering thing, especially in healthcare. I mean, it's not like, something trivial. This is something, could be life or death. And they come to me, the ones who find a patient advocate, they, we don't, we realize we know this, but we realize there's a lot more that we don't know. And that's not a place that we want to make decisions from, not having all the information. So because all that information is out the spokes and in this wheel, I'm trying to bring all that information back into the center where the patient or the client should be. I mean, everybody's using the patient-centered care. It only can be patient-centered care if all of that information is flowing back
Yeah.
to the patient, back to the client. And then they have to be able to understand that and digest it and know what appropriate options and opportunities there are, and that so rarely is happening in an imperfect situation. COVID has made it
Yeah.
incredibly more discouraging or
Challenging.
challenging.
Yeah.
Hmm.
Before we get into COVID, I just want to, because on the beginning when I was talking about your background, I talked about this bachelor's you have in zoology and psychology. So,
Hmm.
in your role of gathering all of the information that's out there, helping people get informed of what they don't know, right? You don't know what you don't know, and helping people get that
Hmm.
information and everybody communicate. Do you also look at things, I'm just guessing, in a much more holistic way than a typical physician would, MD, very scientific, curative model? Because
Hmm.
zoology and psychology, clearly you're seeing the whole self and the multi layers of a person, their emotional functioning, psychological, spiritual, those
Hmm.
interactions. That's my assumption based on those that your bachelor's degree studies. Is that accurate? And do you look at things in a bigger picture?
Well, I did expect today to be revealing for me, but I never really thought about that. I mean,
Mm.
the, yes, all of those. That's probably why I was interested in those things. But I find that what I do, some of the biggest tools in my toolbox are organizational skills, which I think I'm very effective at remaining organized, multitasking because things are headed in a million different directions for multiple clients all at the same time.
Yeah.
But probably the internal medicine piece is the piece that I often reference because as an internist, you know a little about a lot. So I wasn't a cardiologist, I wasn't a pulmonologist, I wasn't a rheumatologist, but I knew rheumatology, pulmonology, cardiology to a point. And then I too needed to know. I know that I don't know all that I need to know, so I needed to send someone to a specialist. So knowing that limitation of your knowledge base and then knowing where to get better knowledge, more knowledge, refer someone. And that is so much of what I do. I have a base knowledge of a lot, and then I know just when I know enough to be able to
Mhm.
stay where we're at, and when I need to push the envelope and say, you know, we really need to get some more help in here. You're not getting adequate help. Again, I can't advise people. I can't give health advice or medical advice. I certainly cannot treat them, but I still have that basis of knowing that you're not getting all the information that you need to make a good decision. And we're going to need to reach out in some other directions to get more input, more data, more information so that you're making a really sound choice for yourself or your loved one.
Well, you can direct them in a way that's clear. I
Mm-hmm.
think we share a lot of the same skills because as a social worker, people call me about all sorts of different problems. And I'm kind of almost like an internist, but in terms of like social um, social interactions, psychology, like where people come to me and say, this is my problem. And then I can kind of say, I know a little about a lot in terms of like
Mm-hmm.
the psychosocial functioning and then can refer people out. It's kind of like we have the same skill set. It sounds
Mm-hmm.
like social work is a lot like what you do, except I, of
Mm-hmm.
course, don't have the medical background to
Mm-hmm.
offer that additional advice, but just like knowing a lot about a little, knowing a
Mm-hmm.
little about a lot. Sorry.
Yeah, or knowing where you can get more information, and I
Yeah,
think that that's
exactly.
key. And I sometimes think that might be what sets one advocate apart from another.
Yeah.
I know where to go. I know the extent, the breadth of information and resources that are available out there because I've worked in that arena, and so I'm able to expand that for people. And a lot of people, that's exactly what they're looking for. So like, I know this is what I've been told, but I know there's got to be a lot more out there. And,
Yeah.
for some people, they're very comfortable with that very concise, this is what you need to do. There really aren't any other choices. And, they'll either come and say, is that true? There aren't. And I'll say, well, there are other choices. This one makes sense. And we're able to kind of talk through it. But there are people who come because that's just the way they handle lots of aspects of their life.
Yeah.
They want all the data. and then they want it all organized, and then they want it to process it, and then they want to understand it, and then they want to step back and make informed decisions. So for many people, I'm helping them make a more informed decision with either the information that's at hand, or they're having me gather additional information. I have a fair number of clients that want to be part of a clinical trial. I can't tell you the number of times I get somebody who, a family member or the person, will come and say to me, they've told me there's nothing more they can do. And if that's true, I will accept that, and I'll work on how to accept that. But if that's not true, I want to know if there are other options and opportunities for me. And many times that ends up being clinical trials. And, that's not something the average person is really equipped to do. To sit
for
down and
sure.
figure out, where do I fit in? What do I qualify for? Is this, reputable, and being able to look at what research papers have come back on maybe it being used in another situation. So again, I think that takes a certain kind of scientifically didactic minded person to be able to help. So when you said, back to your original question, when people call me, I can imagine that, there are advocates who do things that I don't do. There are a lot of people who do billing and billing discrepancies and family mediation. And I think everybody mediates whether you want to or not. But those are areas that I know are not my strong suit. I wasn't a biller or a coder. I didn't work for an insurance company. So I'm not bringing something of value to that person. I would be figuring it out same as they would. But when you get into things that are more scientific and more research and more clinically minded, I really feel as though I can bring, like a nurse or someone who's worked in the medical care field, can really bring a substantial amount of experience to that situation.
Yeah, absolutely. So even within the field of, a certified advocate, you might have specialties or lanes that work the best for you. What would you say are the most, if you can give me like the top 2 complaints that people have about the healthcare system, what would those be? Can you think of 2 things that most people say, or that the majority of people say to you when they call you, a complaint that they have about, challenge that they're having within the healthcare system?
It's communication. I mean, that is the crux of what I do. And it doesn't surprise me, because it was many decades ago I went to medical school. But that was one of the things that was stated, is that, the premier thing you can do to establish a good rapport with your patients, to have them value and trust, the practice of medicine, is, to communicate well and to always be honest. And that still holds true, because of most of the concerns that I have brought to me of people wanting assistance. It is, I don't think I'm not understanding, which still is, either it's not being communicated well, or that person doesn't have the skill set or the experience or knowledge base they need to understand it in the way it's being presented, or they feel as though that person isn't giving them enough information. That very often is the fact. Or the information isn't getting in the hands of the right people, or at the right time, in the right fashion, with, the additional thing, support that I can give, which is, I say, if we need to explain something once, we'll explain it once. And that might be what you get from the healthcare system. If we need to explain it 6 times, I'll explain it 6 times, and we'll just keep working until we have that aha moment. Now I understand what you're saying. Now that I understand what the issue is at hand and what my options are. I mean, it's all about empowerment. You can't be empowered if you don't understand, and you can't understand the medicine unless you've have been well communicated with, and
Yeah. And it's challenging in the healthcare system, because healthcare professionals have a limited amount of time.
they do.
And so I get this a lot too, when my clients call me and then I explain something, they're like, oh, finally it makes sense to me. Well, yes, I'm working privately. I can spend 45 minutes with you
Right.
on the phone and go through that process and explain it and express compassion and empathy during our conversation, all the things that people need and deserve. And the healthcare system, there's just such a crunch of time. I think there's exceptional individuals working in the system, but
Absolutely.
unfortunately with a lack of time. So they wish that they could, spend that kind of quality time with the patient or client and
Mhm.
explain things, but sometimes they just don't have that option. So it is nice for families, if they can afford it, to be able to outsource that to private
Right.
individuals like yourself to get that
Mhm.
support. Talk to me, we're getting closer to probably ending, and I want to talk about the impact of COVID on
Mhm.
what you're hearing with people calling you. And are the challenges for people in the system related to communication, like you said, challenge 1 and 2, communication, or
Mhm.
are
Mhm.
there other things related to COVID that you're finding as an advocate that you're having to really step in and help families navigate?
There are two things, and the first again is communication. I especially, well, I can't say especially, but ICU communication is a very unique thing. There's a lot going on, and those resources and those personnel have been stretched so thin.
Yeah.
So that's extremely challenging to get good information, especially when things are changing so rapidly in a setting like that. But yes, some of my calls, and I think that in all cases across the board, I feel this way about advocacy. All is a win-win-win. The client is better suited and better off by us having this relationship. The healthcare system is better off because I'm able to empower their patients so they do make good choices and they do move forward. They don't take the prescription, fill it, and then put it in the cupboard and never take it because they didn't really understand what it was for, and they were more afraid of it than they were understanding the good it might bring. So in the COVID, the ability of families to not be there, not be bedside, not pick up on those little nuances, not find that moment where maybe they feel like the nurse is maybe not quite so busy that they could get a better understanding. Those situations aren't available. So having a plan where I'm getting a call once a day from the ICU physician, and then able to disseminate that to family members and spend as much time as necessary for them to understand that, to then absorb the questions they have, the concerns they have, and if I can answer them, fantastic. Because it's much better if it's a simple question that I can take care of, that we're not burdening the healthcare system
Yeah.
with those things. So it becomes very, very efficient. But to them, I think it has a quality of they're really finally being heard and they finally understand. So it improves that situation. And then the other unique thing about COVID is, this is the first time we've had something that we don't understand and we're learning on the fly. So when you've got a family member who has it or who is in the ICU, I mean, when I look across the board, my ICU clients that I've had over the scope of a year, our knowledge base that we're working from has changed dramatically in that time. So you've got family trying to, they're Googling, they're on Facebook groups with other COVID families, and, every rock was being looked under for a cure or a treatment that might improve. And they're wanting to know, is this something my family members should have? Is this something I should tell my doctors to look into? So being able to work as a filtering agent for them and work through it and help them research it and understand things that we've never done before. I mean, I think one of the big things is explain to a family that their loved one is prone.
Hmm.
I've They didn't, and why would you do that? And
Hmm.
I'm certain the physicians would love to take 10 minutes and explain the value in that. But being able to help them understand, this is something we found. It's being done, across the world. We're hoping that it will do the same thing for your loved one, and just kind of virtually hand holding through a very tumultuous time. So yeah, those are the two things. There's a lot of unknown and uncertainty. You can't give them statistics like you could if you had breast cancer. You could, state all the
Yeah.
statistics that we have to date. There aren't statistics. There's no sound anything to base a lot of what we're doing in, and then communication.
Yeah. And I find that what you're talking about in terms of the efficient execution of what you can do to be fantastic. Like you're saying, you
Mm-hmm.
have a conversation every day with the ICU physician. That conversation might be 3 minutes where the physician is rattling off some scientific blah, blah, blah. This is what
Mm-hmm.
we're doing quickly.
Mm-hmm.
And then you can turn around and have a 45-minute discussion with the family about what that means. And I think that's wonderful because the
Mm-hmm.
physician can concentrate on what he or she is doing on the floor
Absolutely.
when they're completely overwhelmed. And you and the family can have peace of mind, really understanding what's happening. The other thing that I think what happens sometimes without that mediator, I'm going to call you a mediator right now, that person in between, is sometimes healthcare professionals feel when families ask too many questions, they start getting annoyed with families because they don't have time and they're just frustrated. So they stop picking up the phone. They stop talking to them because they're just so frustrated and annoyed that the family's not catching on fast enough or able to execute what it is that they're suggesting quick enough. And then that just makes everything fall apart and get even worse.
Absolutely.
So it's really
Absolutely.
nice to have you as that sounding board. So how, Dr. Ticoras, if people want to hire you and use you as an advocate, how do they get a hold of you?
I can give my phone number. That's 614-981-5951. Otherwise, I always suggest to people to go to the website. It's a very unintimidating way to kind of snoop around and learn more. I just launched a new website last week, so it's brand new. I think it's very functional, very efficient the way you can work through and gather information. And I always like to encourage people to look at the client stories. No one
Mm,
can say what I do better than the people who I've helped, and their words and the sentiments and just kind of the raw emotion and energy you can feel. People always say, "Oh, I identified with immediately when I could read that. That's exactly how I feel. And if you could help them, then I know you could help me." So the website is www.gps, like a map in your car, gpscolumbus.com.
And
And
I'll put the link for your website in the thread of
wonderful.
this
Thank you.
talk so people will be able to get it. The other thing that I just want to go back to, and I should have said
Mhm,
this before asking you for your coordinates, but when you were saying how people can be involved in, Facebook groups and they're online searching,
mhm,
and I think it's wonderful that we have these tools of, the internet to be able to understand and research so many different things. There's also a level of danger in that as well from all the, misinformation, misunderstanding, thinking that something's going to apply to your situation, but it really doesn't. And I think that your role again can kind of serve to, as you said, filter and
mhm,
really go through all of that information that they're finding in different areas and saying, this is viable, this is viable, this is not, this is not. And then
mhm,
people might be able to just let it go, some of that stress of thinking there's all of these different things I should be doing,
mhm,
because
mhm,
they'll be able to have the real answer of no, this doesn't apply, or yeah, this is
mhm,
viable.
mhm.
Let's look into it.
Yeah, because sometimes that is the call that I get. I just want to be sure there's nothing more I should be doing,
Yeah.
and that's a heavy weight to carry around for a spouse or a child or a parent, um, and the intensity of that feeling, and then what that kind of spurs them on to do on their own has become very, very toxic. Because they're trying to be all things to
Yeah.
that person, and being able, yes, to step in and say, I'll make sure that all that could be done and all that should be known, is done, and you can make decisions, from that, again, that place of empowerment and knowledge, and that brings such peace of mind. And that, at the end of the day, that's my goal, regardless of what you've called me for, or what we're working on, is that there's a level of peace of mind that they did not have until we started to work together and I came alongside and was able to assist them and bring something of value into what they were living day by day.
And that is so important for the present moment, for people to be able to feel confident with everything that they've done, because it helps them
Mhm,
release any doubt, guilt, and to be present with the person and their relationship and be the role that they are, the mother, the spouse, the child, and not have to worry
mhm,
about all that other medical stuff because they have someone like you on board. And I also think if unfortunately things don't go well, like you're saying, we're at our last hope. Where's there a clinical
mhm,
trial? And then if the person ends up passing away, then also the family can feel like we've really done everything we can. We really did, overturn every rock and look, and that helps so much in the recovery from, and the grief and
mhm,
loss process. So it's really nice the service that you provide. It's great for the patient or the client, and of course for the
mhm,
whole family system. And what I'm hearing you say is it also is helping to relieve some of the stress in the healthcare system as well, because you're helping to hold that family's hand in a way that healthcare professionals are limited due to just high ratios of all the tasks they have to do.
Absolutely. Absolutely. It's really, I mean, it's an honor. I love what I do. I'm very passionate about what I do. Um, I feel very, very fortunate that I get to do this part of medicine. It's the part I loved the best anyway. And now I get to do it, 7 days a week if I want. So yes, this is truly work I'm truly passionate about. I enjoy my families, my clients. It's just fabulous. I consider myself quite lucky.
Excellent. So you can catch Dr. Ticoras at www.gpscolumbus, I think that's what you said,
Mm-hmm,
.com. Okay.
mm-hmm.
Don't remember your phone number offhand, but
That's all right. It's on the website.
it's on the website. So I'll
Yep.
put the link in the thread. Thank you so much for
No,
joining me.
thank
Hang
you.
on. I'm going to end the broadcast, but hang on so we can have a quick chat. And thank you, everyone, for engaging. And if you have any needs and you need someone to help you figure out that system, explain things, talk to the healthcare professionals, Annette's your gal. Give her a call.
Thank
Okay,
you.
hang on, Annette.